Generally, a woman would seek genetic testing for breast cancer if there was a reason to believe that she was at increased risk for hereditary breast cancer. And the way that you determine that is generally by meeting with and being assessed by a genetic counselor. So a woman who was concerned about whether her breast cancer is hereditary or not could come in and meet with a genetic counselor who would take a family history, including the person's medical history and their entire family's medical history, particularly paying close attention to cancers and what type of cancers people had. And they would use that information to come up with an assessment of the likelihood that the cancer in the family is due to a genetic factor.
If a woman has a genetic abnormality that puts them at high risk for breast cancer, they are at a much higher risk for additional and future breast cancers. For a lot of women, this means that they may choose a full mastectomy instead of a partial mastectomy. When I see a woman who has a new diagnosis of breast cancer, as part of the evaluation, I always ask about their family history. If they have a family history that includes multiple other relatives with breast cancer or ovarian cancer, they are considered at high risk for a genetic mutation for those diseases. These are the BRCA mutations. If the risk level is high enough, that woman needs to go for genetic testing. And the results of that testing can influence their decision regarding their surgery.
If a woman has a gene that puts them at risk for hereditary cancer, their risk of developing cancer in their lifetime is hugely increased. There are actually many types of hereditary forms of cancer. The most common and the one most people hear about are hereditary breast cancers, and those are typically due to one of two genes, either the BRCA1 gene or the BRCA2 gene. And if a woman were to carry one of those genes in a atypical form, which is what the test is looking for, then you would find that yes, the woman's risk of breast cancer would be much increased over the general population. And in addition, she would also be at risk for additional cancers. And primarily you would think of ovarian cancer that oftentimes goes along with having alteration in one of these genes.
So the question is, if a woman is diagnosed with a BRCA1 or BRCA2 mutation, is she at risk for both breast and ovarian cancer? And it really depends on the mutation. So a woman who has a BRCA1 mutation is at somewhere between a 50 to 60 to 85% lifetime risk of breast cancer, and she has somewhere between a 40 and 60% lifetime risk of ovary cancer. A woman who has a BRCA2 mutation, BRCA2 mutation, still has about a 60 to 85% lifetime risk of breast cancer and about a 17 to 27% lifetime risk of ovary cancer. So they're a little bit different.
When we have a new diagnosis of BRCA mutation, we sit and talk for quite a while about the option of mastectomy of both breasts versus the other option, which is close surveillance. For these women, this would include not only a regular clinical breast exam, mammography, and perhaps ultrasound, but also will include breast MRI on a regular basis if they do not choose to have mastectomy.
So when we talk about counseling women, we talk to them about prevention if they don't already have cancer. And prevention can take one of several routes. One, it could be more screening. So in other words, women that carry a BRCA mutation, particularly if they have a family history of breast cancer, we screen them twice a year. We use mammography alternating with MRI. We can offer them prophylactic mastectomy, which reduces the risk significantly. We also may offer them prophylactic salpinga oophorectomy, removal of the ovaries and the tubes. The problem with ovary cancer is we're not very good at screening for it, so we tend to be a little more aggressive in terms of surgical reduction. So we really look at screening versus removing the organ that's at risk.
The Supreme Court came down on the side of our own civil liberties and indicated that the ability for the patent office to give patents to genes is no longer going to be the status quo. And in doing so, that is going to help all of us.
I think what we're going to see is we're going to see more research. We're going to see more testing developed. We're going to see lower cost. Right now the test is over $4,000. It's very expensive. $3,000 to $4,000 actually. And so I think that more women will have access to the testing, and the testing may get better. That's what really hope will happen.
This was really groundbreaking, in that it's not only this gene now that is open, but it's going to also open those other 4,000 genes that have thus far been patented. It's now going to give us an ability to argue before a court to allow those genes to be further researched, to be made available for evaluation and studies by multiple companies. And in doing so, reduce the costs of testing and promote research.
The ability of additional laboratories to provide genetic testing for hereditary breast cancer is very important for multiple reasons. And one of the major reasons is for research, because the more laboratories that are allowed to look at the BRCA genes, to test the BRCA genes, the more we're going to learn about them. And particularly when we're talking about test results that come back ambiguous, the variations of uncertain significance, the more information we have from many laboratories, the more likely we're going to get people true answers in those situations.
Hopefully, with the Supreme Court decision, there will be other companies offering these tests to the patients. Therefore, with improved access to testing, we should be able to get those results much more quickly and be able to walk women through the process of decision-making for surgery at a much more rapid speed. This will improve overall treatment as well as patient satisfaction and markedly decrease their anxiety level during this time period.